this video, I'm going to show you some really effective and simple jaw exercises that you can do to relieve the symptoms of TMJ disorder, teeth grinding, jaw clenching, headaches, and even migraines. It's really important to remember that these exercises won't work for everybody, and it also depends largely on why you're getting these symptoms in the first place. So it is really important to make sure that you have sought professional medical advice before executing any of the exercises that I'm about to show you. TMJ stands for temporal mandibular joint. So we're essentially talking about your jaw, or more accurately, where the jaw connects to the skull. It's a condition that affects the movement of the jaw and can cause a number of symptoms, including pain around the jaw, the face, ear, even the temples. It can cause a clicking, a popping, grinding sensation when you're using the jaw. It can cause difficulty opening and closing the mouth. And then, as we mentioned earlier, it can also cause and contribute to headaches, migraines, and even dizziness. The disorder can be caused by teeth grinding, jaw clenching, general wear and tear and overuse of the joint. It could be a historic or a recent injury, like a blow to the face or an impact injury to the jaw directly. It could also be dental issues. You might have an uneven bite, for example, and also stress, muscular tension through stress, anxiety, and those types of conditions. Targeting the masseters and temporalis muscles in one controlled stroke, take 3 or 4 fingers and apply gentle upward pressure starting just below and to the back of the jawline. Keep the jaw relaxed and allow the fingers to slowly slide up the side of the face as the skin slips beneath them. Repeat this around 2 to 3 times and around 3 to 4 times per day as needed. Focusing on the masseters, which are one of the most powerful set of muscles in the human body, take 3 or 4 fingers and apply comfortable inward pressure starting just below the cheekbones. Keeping your jaw relaxed, work your fingers down the muscle using that constant but comfortable level of pressure. These muscles can generate up to 200 pounds of pressure when closing the jaw. So if you grind or clench, you now have an idea of how much pressure is constantly being applied to your jaw, teeth, and radiating into your skull. The temporalis muscles connect to the jaw just behind the cheekbones and originate from the top of the skull. So hopefully now you can see the connection between TMJ issues and headaches if this muscle is fatigued, overused, tense, or in spasm. Take 3 or 4 fingers and apply comfortable upward pressure starting around the temples. Remember, the pressure should always be comfortable and never painful. Keeping the jaw relaxed, slowly work your way up the muscle using a diagonal stroke ending at the top and towards the back of the head. As an alternative, you can also slowly open your jaw as you work up the muscles to increase the stretch sensation. This exercise targets the masseters, temporalis muscles and the deeper TMJ muscles called the pterygoids. There are 3 parts to this exercise, but the execution of them is identical. To begin, place your hand under your chin using your fingers, knuckles or palm, whichever feels most comfortable for you. Apply a gentle upward pressure of roughly 10% of your maximum strength, whilst at the same time equaling that pressure by opening your jaw. The jaw should be partially open, but not moving. This is called an isometric hold. Repeat this in the opposite direction, gently pulling the jaw down with your fingers on the chin or on top of your bottom set of teeth and resisting with equal upwards force using the jaw. The same principle is applied to the left and right side of the jaw also. Hold each one for roughly 10 to 15 seconds. Depending on the nature of your condition, soft tissue and manual therapy can be really effective at treating and managing the symptoms of TMJ disorder, headaches, and even migraines. So if you suffer with any of those, then get in touch and we can chat more about your individual needs.